Dear students, today we will discuss about the new chapter, that is tablets as a dosage form. As everybody know about the tablets are very much famous dosage form, and it is comprised of most of drugs converted into solid dosage forms. Tablets are nothing but the solid unit compressed dosage form. Contains one or two medicaments. Generally, it is circular in shape or flat, as well as maybe biconvex. So, it can be defined as a compressed solid dosage form containing medicaments with or without excipients. Pharmaceutical tablets are solid, flat, biconvex, Dosage unit dosage form, generally prepared by compressing drug as well as excipient, sometimes with or without diluting agents. It is most of popular dosage form, and 70% of total medicines are dispensed in the form of tablet. Now, advantages and disadvantages of tablets. There are versatile advantages of tablets. That's why it is most famous dosage form and favored by the most of patients. It is easy to administer, it is easy to dispense, as well as it is more stable compared to the liquid dosage form. There is the accurate dose containing in the one tablet. Sometimes bitter and nauseous substances also can be incorporated in the form of coated tablets. It is light as well as compact compared to the your liquid dosage forms. That's why transportation cost will be the less. It is also economical one, that is production cost is less. That's why it is economical for the most of people. Then sustainably product can be prepared by using the enteric coating or using the different types of polymer. We can maintain the controlled release or pre-decided release of your drug. Along with the advantages, there are the disadvantages also. So these tablets may have the sometimes problem with the compression for the crystalline drug, as well as some hygroscopic drugs are not suitable for the tablet because they absorb the moisture and they will get swell, and your tablet automatically will get burst. So these are not suitable candidates, those drugs which are having the tendency to absorb the moisture. Drugs with low or poor water solubility, drugs with the slow dissolution are not suitable candidate of the tablet, because after the injection, after the taking the tablet, so it has to dissolve inside the gastric fluid, and then after that your drug will able to dissolve, and it will be ready for the absorption purpose. So the dissolution step is the rate limiting step for the absorption, and it is also, we can say, rate limiting step for the bioavailability of your drug. So those drugs which are having the good water solubility, they are having the, you can say, good candidate for the tablet. Now cost of production may be increased because of the some specific type of coatings if it is required, as well as some drugs are having the light sensitive nature or bitter in nature or unpleasant taste. So in that case, we need to use some specific type of extra ingredients, so it can increase the cost of your product. Sometimes geriatric patients as well as pediatric patients may have the difficulty in swallowing the tablets. Sometimes some patients may not accept the bitter taste of the drug. So these are some disadvantages of the tablets. Now the types of tablets. There are the 4 categories of your tablets. Majorly, first category is those tablets which are ingested orally. It means that tablets are reaching to the stomach. Second category is the tablets which are used inside the oral cavity only. It means their tablets are used only in oral cavity. They are not ingested third category is the tablets which are used for the treatment of the patient by other route or other than oral route, that tablets can be used. Another or the last category is the tablets used to prepare the specific type of solutions. So these are the four main categories of your tablets. We will see one by one. That is, the first one is the types of tablets, that is the compressed tablets. Now the compressed tablets means those tablets which are prepared by compressing with the help of your machine along with your adjuvants as well as your diluting agents. Okay, so in this case we are using the diluting agents as well as the filler or some binding agents or adhesive agents, some disintegrating agents, some anti-adherents, ligands, as well as the other type of material is as required. Now when we are compressing the tablet, that is the, we can say, simple tablets. Sometimes the same tablet can be compressed more than one time, that is called as the multiply or the multiple compressed tablets or multiple layer compressed tablets. Generally, sometimes suppose two drugs we want to give to the patient. So one drug is already compressed, again some material will be added on the same tablet and again it will be compressed. So by this way there might be a formation of the 2 or 3 layer phases, it is possible. So sometimes we can deliver 1 or 2 drugs by using the single tablet. So depending on the requirements we can prepare the different layer tablet. So it is called as the multiple layer tablet. Now another type of tablet is the sugar coated tablet. Now sugar coated tablets means what? Those drugs or those tablets containing the bitter drug or unpleasant drug. So that tablets may not favored or accepted by the child as well as the geriatric patient or most of other patients also. So to hide or to mask the taste of the drug, generally we used to coat the tablet paste or the tablet surface by using the sugar solution. It is called as the sugar coated tablets, or simple you can say, if you are coating or covering your general tablet with the help of sugar solution or the sugar film, then that type of tablets are called as the sugar coated tablets, which are having the sweet in taste because of the presence of sugar coat. Then another types of tablet is the film coated tablets. Film coated tablets means those simple tablets which are coated with the specific type of film by using the different type of polymers. So when we are using the such kind of particular any polymer having the particular properties and we are preparing the tablets, then that type of tablets are called as the film coated tablets. There are so many polymers generally available to coat your normal tablets. They are ethyl cellulose, Dosage RS100. So generally there are so many objectives behind the film coating of the tablets, that is to protect your drug, to give the protection from the humidity as well as the moisture as well as your light. So also from the gastric fluid also you can protect your drug by using the films. So these are the film coated tablets. Another one is the gelatin coated tablets. Suppose especially if you are using any gelatin material for the coating of the tablet, then that type of tablets are called as the gelatin coated tablets. So to give the protection to your tablet, we can use the gelatin. Depending on your requirements, you can use the gelatin or any type of other polymers. Now another one is the enteric coated tablets. Enteric coated tablets means nothing but the film coated tablet itself, but the polymer which is used for the coating purpose, it can have the ability to dissolve only in the intestine. It means at the basic pH. So that we can say that pH dependent solubility polymer we are using for the coating purpose. So here your tablet will bypass from the stomach, or it will not dissolve inside the stomach, and it will reach to the intestine, and there at the basic pH it will get dissolved and it will release your drug. So this is the, we can say, one advantage of that polymer solubility. That polymer will not have the solubility in basic acidic pH, and that polymer we have used to coat your tablet. And when such kind of tablet is passing through the stomach, it will not dissolve, it will remain as it is, intact, and then after your gastric empty process to start, it will reach to the intestine, and there, because of the nature, it is having the solubility in basic pH, so it will get dissolved inside the intestinal pH, and your drug will get released inside your stomach. Another type of tablet is the buccal as well as the sublingual tablets. So these are the specific type of tablets which are used in the oral cavity, generally for the treatment of your oral problems or the teeth problems. This kind of tablets we are using. Generally these tablets are placed between the cheeks as well as the under the tongue. So these are buccal and sublingual tablets. So they will give the dissolution of the tablet, and there itself it will be absorbed to the oral mucosa, and drug will reach to your systemic circulation. Another type of tablets are there, that is the lozenges as well as the troches. Nowadays very rarely we are using the lozenges as well as the troches. Generally they are disc shaped, solid dosage form, contains medicinal agent, and generally having the flavoring agent as well as the sugar base. That's why they are hard in nature compared to the normal tablets. Then chewable tablets. Chewable tablets are nothing but those tablets. Generally they are dissolved inside the mouth because of the chewing action. That's why they are called as the chewable tablets. The very famous example is your antacid tablet of Gelusil. So we have to chew that tablet, and slowly the drug will get released from the tablet, and it will pass to the orifice, and it will try to neutralize your acid. So this is your chewable tablet. These tablets are chewed, and drug will get dissolved inside the mouth, and it will form the creamy base, and it is having the menthol as well as sweetening agent as well as flavoring agent. Then some effervescent tablets are there. Generally these tablets are having the ability to produce the effervescent. That's why they are called as the effervescent tablet, and these tablets are dissolved inside the water prior to administration, and that after that it will dissolve inside that water, and when the bubbles will form, immediately we have to administer that solution. That kind of tablets are generally used for the preparation of the solution itself, that they are called as the effervescent tablets. Then another tablets is the molding tablets. These are very old type of technology we are using. Certain tablets may be prepared by the molding rather than the compression. The resultant tablets are very soft as well as the we can say soluble in water. Very easily they will get solubilized. Then tablet triturates are there. So these tablet triturates are nothing but the near to same as like that molded tablets. Generally these are prepared by using the alcohol or any kind of highly volatile solvent, and they are not having that much hardness. Very easily they can break down. So this tablet triturate as well as the molded tablets nowadays we are not using. Now another type is the hypodermic tablets. These are the also we can say old type of tablets. We are nowadays not using this kind of tablets. They are originally used by the physicians in the extemporaneous preparation of parenteral solution. The required number of tablets dissolved in the suitable vehicle, and we have to prepare the solution of the tablet. Actually, when we are preparing the solution, so that solvent must be sterilized one, or after preparation of the solution we have to sterilize it, and then we can inject them. Then these kind of tablets are having the particular dose of the drug. That's why it is easy to prepare the particular concentrated solution by using the number of tablets. You see, these are the pictures of the tablets, hypodermic tablets. Then some dispensing tablets are there. They might better have been termed compounding tablets, because the pharmacists use them to compound prescriptions. Actually, when in old days there was no tablet machines were available, so at that time physicians was prepared one order of dispensing some tablets to the pharmacist, and at the time our pharmacist was compounding some particular type of tablets with the normal handle machine or single punch machine. They are called as the dispensing tablets. Another tablet type is the immediate release tablets. Immediate release tablets means those tablets which are designed to disintegrate very fast as soon as we are adding them into the water. So to give the fast release of the drug, we are preparing the immediate release tablet. So in emergency conditions, generally we require the very fast release of the drug or very fast action of the drug. In that case, we can use the immediate release tablets. Another tablet is the extended release tablet. It means those tablets which can deliver your drug for the longer period. So they are called as the extended release tablet or the sustained release tablet. Generally, we used to coat that tablet with the help of some polymers which can avoid the rapid dissolution of the tablet. So they will avoid the rapid dissolution. Very slowly your tablet will get dissolved, and very slowly your drug will come out from the tablet, and it will get solubilized and absorbed. So in a controlled manner, we can release your drug that are called as the extended release tablets. Now some specific type of tablets are like that. Vaginal tablets are there. For the specific cavity purpose, we can prepare the tablet to deliver your drug at particular site of your body. We can prepare such kind of tablets. So these are the vaginal tablets. Then instantly disintegrating or the dissolving tablets are there, which is also called as the fast disintegrating tablets. Generally, these kind of tablets are having the ability to get dissolved rapidly or disintegrate very fast as soon as they are reached into the liquid medium. So they are having the same objective to deliver the drug very fast to your body. Now we will say regarding the tablet excipients. Now what are the tablet excipients? These are those materials generally we are using them to prepare your tablets. Without these excipients, your tablets cannot be prepared. The main excipients among your tablet content is the diluting agent or the diluent or the filler. So they are also called as the bulking agent, or they are having the, we can say, ability to increase the size of your tablet. When your drug quantity is very small and you are not able to prepare its tablet or its quantity is not sufficient, so in that case we have to use any diluting agent or any filler. So there we can various examples are there. We can use them as a diluent like lactose. After that sugar or the sugar, alcohol, glucose, sucrose, then cellulose, hypocrystalline cellulose, dicalcium phosphate, dihydrate. Now what are the ideal requirements for your good diluting agent? Whenever you are choosing the any diluent, so we should confirm about its some properties. As when we are using the diluent, so it should be chemical inert in nature, as well as it should be compatible with your drug. It should have very cheap cost. Then it should be non-hygroscopic in nature. It should have the good biopharmaceutical properties, as well as it should be water soluble, as well as it should be compatible with the other ingredients and your drug, and it should have the acceptable taste as well as the color. So it should not interact with your drug. So like this, ideal property should be there to be a diluting agent. Then another important parameter or another important ingredient is the disintegrating agents. So disintegrating agents are those agents which are able to disintegrate or to break your tablet inside the stomach, or when that tablet reaches to the gastric fluid. So generally this disintegrating agent absorbs the gastric fluid and they get swelled. Because of that swelling, the tablets will get easily break. So there are so many type of disintegrating agents we can use, like starch powder, as well as cellulose like sodium carboxymethyl cellulose. Then another ingredient is the binders. Okay, binding agents or the binders are those agents which are having the ability to keep all the particles bounded at one place. They are called as the binding agents, like starch paste, glucose, as well as some gum solutions like acacia gum, as well as the tarragon gum. We can use as a binding agent. Gelatin solution, sucrose solution can be used as a binding agent. Now, incorporation of the binding agents or the binders. Sometimes we can use the binding solution or the as it is we can add as a dry powder. So these are the, we can say, two types of binding solutions or the binding agents we can use in the form of dry powder or in the form of solution also we can use. Now another ingredient is the lubricating agents or the lubricants. They are used to prevent the sticking of the granules or the powder to the die cavity or the wall, and to promote the smooth ejection of the tablet from the die cavity. When we are pressing or compressing your material and it is converted inside the into the tablet form, so that tablet should be easily ejected from the die cavity. It should not stick to the die cavity. That's why we have to use the lubricating agents. There are the magnesium stearate, calcium stearate, talc, stearic acid, sodium lauryl sulfate as a lubricating agent. Now the glidants or the fluids are there. So sometimes we are adding the glidants or the glidant agents. Generally these agents are having the ability to improve the flow of your granules or the flow of your powder when they are passing from the hopper. So in the tubes sometimes it may get choke up. So to increase the flow property of their powder, we are using the glidant agents. Generally glidants will fill up some cavities of your tube and they will make the smooth surface. So there will be the easy flow of your material from your hopper. So there will not be any problem into your tablet weight. So weight variation will be reduced because of the using of the gliding agents. So there are the commonly used glidants are talc, colloidal, silica in 0.2% concentration. Now anti-adherents are also having the same action. They reduces the adhesion between the powder and the punch faces. So they prevent the particles sticking to the punches when you are pressing your tablet. Then after the removal of the pressure or after removal of your punch, so some materials sticks to your punches. So that will cause the weight variations. To avoid such kind of problem, we are using the anti-adherent agent. Generally talc, starch can be used as an anti-adherent agent. Then another example is the example of your ingredient is the sorbents. Generally these are the substances that can have the ability of capturing or sorbing some quantities of the fluids inside from your tablet. It means they will try to absorb some excess amount of moisture. So they are called as the sorbents. Sometimes oil or drug solution can be incorporated inside the powder mixture while mixing your tablet and excipients. So in that case, generally the solvent agents are used to absorb the excess amount of moisture or the excess amount of oils. So microcrystalline cellulose can be used as a sorbent agents. Then flavoring agents or the flavors are there. So to give the aesthetic or to improve the aesthetic value of your dosage form, we need to use sometimes flavoring agents. So if your drug is not having the pleasant taste, so in that case we can use the flavoring agent to increase its taste. Sometimes your drug may be bitter in taste, so we can use such kind of flavoring agent. Okay. Coloring agents are also used. They are used to improve the elegance or the color of your tablets. Sometimes your drug or any other ingredient is not having the suitable color or the attractive color. So to increase the attractive nature of your tablet, we can use the coloring agent. Sometimes we can add the solution form or inside the dye form also we can add your color. Then sweetening agents. Sweeteners are those agents which can have the sweet taste or they can have the bitter taste or the unpleasant taste of your drug. Many times we can use the sugar, glucose, mannitol as well as